Hi, my name is Kim Carter. I'm an assistant professor in the Department of Physical Therapy in the College of Health Professions. Are you having trouble teaching your students about clinical reasoning? Well, today I would like to talk with you about how I use case study videos throughout the curriculum to develop those skills. Clinical reasoning is a very important skill for all healthcare professionals. It involves gathering and analyzing data, prioritizing findings, and then using that to make sound decisions on patient care. But students struggle with using information that they've learned in the classroom and translating that into the clinic. And case studies are a great way to bridge theory into practice. In the paper cases, abnormal movements were described and common terminology used, but the students were having difficulty using that information. So I decided to add patient case study videos into my instruction. And I'll never forget the first time that I introduced that in the class, I started noticing that the students were leaning in. I could see the gears turning. There were lots of questions. We had a very engaged discussion. And then when I presented those same videos in the second and third year, we spent less time reviewing foundational concepts, and now we had all of this time to develop more advanced clinical reasoning skills. So then I was able to scaffold these videos throughout the curriculum to help develop their clinical reasoning. So in the first year, we focus more on remembering and understanding. We show short videos. I'm helping them recognize abnormal movement patterns and kind of linking that to foundational concepts. Prompts that I might use are, do you notice the abnormal movement here? What type of muscles or what muscles do you think might be involved here? Do you notice this abnormal posture? So any assessments that are done at this stage are very low stakes. In the last year, the students are now expected to do independent clinical reasoning, independent clinical decision-making, and plan creation. The videos are now longer, and they include ambiguity as well as unexpected clinical challenges. So now the students are told to justify their decision-making. They are making comprehensive plans of care as well as predicting outcomes. We're supporting this higher level thinking through faculty support, peer feedback, and comparing their answers to expert clinicians out in the real world. So the questions that I might ask at this time is, how will you respond to patient changes? How will you modify your plan of care to meet those long-term goals? If you're looking to deepen your students' clinical reasoning, I suggest that you scaffold patient case study videos over the curriculum. It builds confidence, it enhances pattern recognition, and it helps prepare them for the real world of patient care. Just start small, build over time, and watch your students grow into critical thinkers. Thank you for your time.